Hello, it's Breast Cancer Month, Breast Cancer Awareness. We want to tell you that as a radiology employee, we want to remind you that don't forget to get yourself checked. The number one job that you have to do on earth as a human being is to take care of yourself. Don't think that the doctors will do it for you. It is not their job. Their job is to guide you beside God, which is the number one doctor that will take care of you. You, as a patient, your number one job is to take care of yourself, to make sure you're on top of any type of sickness that you might have or anybody in your family might have. It is your job to check and make sure that you don't have any type of those sickness or disease or whatever that it might be. As a woman, if there is someone, like I said, in your family that you know of, if it's your mother, if it's your aunt, if it's your sister, if it is someone that is part of your family that has breast cancer in the past, whether they survived it or whether they died from it or whether they are going through it right now, you as someone who is part of that family, it is very important for you to go to your doctor, especially if you are in your 30s or early 30s. It is very important to you for you to go see your primary care doctor and mention that to them and let them know that you would love to get yourself checked so you can get a script from your doctor and find yourself in a radiology facility where they do mammo. So you can request a mammogram of your breast so they can take a look and make sure that there is no sign, there is no lump, there is no bump, there is nothing that might be forming in your breast. The earlier, the better. The earlier we can rule these things out, the better for you. In the past few years, especially for the past year or so, us in the radiology department, we've been seeing a lot of young female that has been coming, and we've been finding cancer, early 30s, 35. So they are in the 30s, especially in our community, especially people from the Caribbean. We don't know what it is, if it's the food that we eat, the food that they eat, or I don't know what it is, but we've been finding a lot of young female that been coming in here with lumps and bumps, and and we do biopsies and we find out that it is cancer. So we want to alert you. We want to let you know that it is very serious. It is very important for you to go to your doctor, to go request for a script, to go to the radiology department and request a mammogram or a sonogram of your breast. It depends on how severe that lump or that bump is, so that they can rule out if it's cancerous or if it's not cancerous. And if it's not cancerous, I suggest you, as a brother, as a friend, if it's there, even if it's not cancer, get rid of it. Cut it. Tell the doctor, just cut it. Just do surgery. Okay? We don't know what it is. Well, let's get rid of it. We don't need anything to be forming in the next 5, 10, 15 years from now. So the earlier you can get rid of it, the better it is for you. And again, remember, like I said before, every time you're taking a shower as a woman, check yourself. Touch everything. It is your job to do that. The doctors are not going to do it for you. They only going to go based on what you tell them. Where the problem is, where the bump is, that's what they're gonna go based on. But even if you don't feel nothing, every time you're taking a shower as a woman, as long as you have breasts, I think it is the right thing to do to just check yourself and make sure there is nothing in developing, nothing is forming, nothing is just get rid of it early. The earlier, the better. And I pray that this message will go around to everyone that needs it, so that we can get rid of this cancer thing. I'm telling you, if there is one thing that I dislike, is cancer. I lost my mom last year due to cancer. It wasn't breast cancer, but it was lymphoma, which is another serious type of cancer that we have in our community, the black community, that is doing a number beside prostate, beside colon cancer. We have colon cancer that is doing a number in our community. We have prostate cancer that is doing a number in our community. We have breast cancer that is doing a number to our young women and women in general in our community. And now, come to find out, lymphoma, which is cancer of the lymph node, is another type of cancer that is doing a number in our community. Beside the heart disease and the high blood pressure that a lot of us are losing family member and friends from. So we do have a number of job to do. We have to do better. We have to better take care of ourselves, our family and friends. We gotta keep an eye on them. Some of them are very, very limited when it comes to knowledge, when it comes to healthcare knowledge. They are very limited. If you know someone that might need your help, you can become a consultant to them. You can become an advocate for them so that you can help them to take better care of themselves. The goal is to have you guys around longer. I would love to live forever if I can. So for that to happen, we gotta look out for each other. We gotta look out for each other. Okay? Be gentle to yourself. Take care of yourself. Eat the right way. Stop eating junk. Okay? Drink a lot of water. Drink the teas that you need to drink that will prevent you from having all these type of stupid cancers that I can't stand, My prayer for you is to be cancer free and breast cancer free. That's my prayer for you.